1, 2, 3. Listen.
Thank you. My name is Prashant Tandon. I come from New Delhi, India. It's a pleasure to be here. I'm the co-founder and CEO of 1MG, which is a digital health platform for India. What are we trying to do? We are just trying to do a simple thing, make healthcare work for patients. So healthcare is the noblest of services. It's what can do miracles. A lot has been done. Diseases have been eradicated. Lifespans have been increased. Mortality has been lowered. Productivity has improved in lives. So much this sector has done. So there's a lot to feel good about, actually. But somewhere along the way, it seems people are losing faith. This picture kind of says it all. It's a picture of helplessness. It's a picture of someone when they are at their most vulnerable, feeling things are not working. And this is a very common situation, not only in India, but I think in many parts of the world. Why is this happening? So we try to look at it. There is tremendous opacity. For a common person in India, it's very hard to deal with healthcare. They're almost told that this is something you cannot understand, so let us tell you what to do, and you just follow. You know what? People don't like it. People want to understand what's happening to them and why. There are misaligned interests. People do not feel that the healthcare ecosystem has the same interests as their best health in mind. That hurts. There is already poor access. There are hardly any choices. And within those choices, they really don't get to decide. That's something they don't like either. And it's become very transactional. There's no database life cycle approach. So there's one opportunity, you deal with a healthcare entity, and what you see is that entity really wants to just maximize, suck out whatever it can from you in that one interaction. And on top of it, India does not have much of health insurance, so it's really all out of pocket. So all this is creating something that is pretty significant, which is a trust deficit. And that's actually what we believe is at the core of the problem of healthcare for a lot of people around the world. We thought, is there a way technology could address this? Is there a way we could just take this out of the equation? And we created an app called 1MG. All it did was, it was the database of medicine. The first aspect we picked was medicine information. For off-patent drugs in India, there are hundreds of drugs trying to sell just the same salt. And on January 21, 2013, a message struck a chord. The message was very simple. What the app showed was, for the same medicine, you could get way cheaper alternatives because the market was not working here out of opacity. What was not working? Basically, these medicines are the commodity generic salts hundreds of brands are making, and a working market, prices should collapse. In healthcare, prices keep going up because the patient has no idea, and frankly, the more margins a pharma company has, the more influence it has on the doctor. So we had this amazing situation and put out this app. What happened next? In 3 days, it went viral on social media. 300,000 downloads in 3 days, and that journey has only accelerated from there. Today, 20 million users a month come onto this platform looking for transparency. We've extended it to include other sources of information, whether be it about diagnostic, lab tests. We'll include procedures as well soon. We also then provide access through the platform. Your medicines are delivered at your home. Your lab tests are conducted at your home. Consultations, click off a button. So we are taking healthcare to the people through this platform. Essentially, what are we doing? We are placing patient at the center of healthcare. Today, we are providing a model that gives them better access to health information, products, and services. We are generating a lot of data, a lot of trends. Tomorrow, that is what is going to change healthcare and make it much more personalized and data-enabled. That's the direction we'll be headed. Today, we cover over 650 cities with our services. We provide jobs to around 1,000 people, direct and indirect, and have raised around $34 million to support us through this journey. We believe we have just started, long way to go. Thank you.
Doing something you haven't heard.